Atrial fibrillation in most patients is thought to be related to either inflammation or scar in the collecting chamber of the heart. And since those heart cells are not necessary for normal heart function, if we can kill the cells that are scarred or inflamed, then we know from scientific data that we can reduce the total amount of atrial fibrillation and in a good amount of patients completely prevent atrial fibrillation from coming back. And also it can allow us to have an effective substitute for medications that are often used to treat atrial fibrillation, which can have their own side effects and costs, and also require frequent monitoring for side effects as well. Pulsed field ablation is an improvement on our previously used technology, which was called radiofrequency ablation, and that was used for the last 20 years in cardiology. And pulsed field ablation is thought to be safer than the old way of doing things.
We use a tool that's considered the top notch for this type of procedure. The new technology makes the procedure much safer and also much faster. So we can do more procedures in the same amount of time with increased safety for the patient.
So during an ablation procedure, we go in with very small catheters and sheets, similar to an IV, through the veins in the upper leg, and we use the specialized Sphere 9 pulse field catheter to create a 3D map of the heart and essentially create an electrical map of the heart. And then we use the catheter to deliver energy to the heart cells that cause atrial fibrillation and essentially make those cells not electrically active anymore. And those cells are not necessary for normal heart function.
That's good.
Patients who might benefit from this procedure are basically anyone who's been diagnosed with atrial fibrillation. We welcome any patient who has that diagnosis to be referred to our clinic through their primary care doctors or really any other doctor. If you feel poorly during atrial fibrillation, if you have atrial fibrillation and you need to or would like to discontinue your medications, ablation may be an excellent option for you.
It's a victory for us because making the procedure safer and more efficient will allow us to do more because, as a matter of fact, we have more demand than supply. So this ensures that we can deliver this useful therapy in a timely fashion for more veterans.